Hi everyone! It has been a very long time since I've filmed, at least to me, and I thought that it would be just a nice change of scenery to sit outside and film. And I know it's going to be different because there's a lot more noises out here, but I wanted to just switch things up, and I feel like I just keep going. I feel like I just keep going from one corner of my room to the other for like every video so that it's not the same, but like it's the same. So I came out here today. Hopefully it's nice and peaceful. Hopefully it's not too disruptive. This week I'm going to be talking about aging, and there's so much that goes into this topic, but specifically I'm going to be talking about what it can be like for an aging person, an older person, when their mental, cognitive abilities or physical abilities are deteriorating and decreasing, because I feel like that's just something that's so important to always remember and keep in mind so that you are interacting with older people in a way that is understanding and kind. So like I said, aging can bring so many changes to a person, and some of them are more well received, like wisdom, although you don't have to be old to have wisdom, but that's just like one of the things that's more well received when you are aging and getting older. But of course, the parts that people very often don't like about aging is when they used to be able to do things and are no longer able to, or just not able to do them as well. So one thing that I read that I feel like the example just kind of like fueled this whole desire to talk about this. Imagine a older adult at a crosswalk where they, press the button, and so that they can wait for the little picture to tell them that they can walk, or to hear the noise to let them know that they can cross the street. I don't know, but whatever the reason, the crosswalk times, like, they are different depending on where you're at. And what I want you to think about is an older person using a crosswalk, walking across the street, and not realizing that they're going to need more time than they used to because of, the aging process. They might have significant or just some sort of like medical physical condition that keeps them from, or that decreases their walking speed, but it really could also just be the fact that they are getting older and their body moves slower. The aging process is, for certain aspects, it is gradual. It's not just like everything happens at once. One day you just wake up and you're now considered old. Like, it happens gradually. Not everything, but certain things happen gradually. And again, I said earlier, sometimes there can be some type of condition that keeps a person from being able to move to their previous maximum ability. So older people are having to adapt. There's that trouble with, I used to be able to do this. I used to be able to cross the street. I used to never have issues with doing this or doing that. And they have to come to the realization that their bodies are not the same anymore, that they have to be more patient with themselves, that they have to anticipate needing more time to do things like cross a street they might not have had problems in the past with getting from this side to this side, but now when they notice that they are losing certain abilities, not being able to function at maximum capacity, they need to learn to adapt, and that's not always easy. Even when it's something that's not forever, like I'm thinking right now when my muscles are sore, or if I like hurt myself or something, like if you hurt your toe or your finger, like you have to adapt to not being able to walk right, or not being able to hold something, pinch something, whatever it is, whatever you can think of that you can kind of relate to the situation of having to adapt to something, and knowing full well that you had the ability previously and now you no longer do. Just, picturing that and relating that to what I'm talking about, to aging, to knowing that you could do something and having to realize and accept that you need to change because your body is changing, because your mind is changing. And I just want you guys to think about that, because I want you guys to be able to put yourselves in their shoes, to realize that it's not easy for them, that it's not like you're old, that's just how things are for you, like figure it out. That's not how you should be thinking, that's not how you should be operating, treating older people. You should be considerate of their own struggles. I mean, it's the body, it's the mind. They don't have complete control of that. You don't have a complete control of that all the time. And I don't think that it's something that everyone looks forward to having decreased abilities to do things. So I'm asking to please consider that, and please think about that. Realize that it is a struggle for them as well, not just physically but mentally. They have to come to that realization. Don't push, don't rush, don't make someone feel bad because they potentially already are struggling, and it's not like they broke a bone and it's something that can be put in a cast for however many weeks and it'll heal and then they can resume what they're doing. That is just how things are going to be, and I don't say that to make them feel or to make you not want to get older, but I just say that because it's important to note that this is something long term, and grappling with that, having to come to that realization, to that conclusion, is not easy. And patience is just so needed. I ask you guys to please be patient. Please just always try to put yourself in other people's shoes. You might not understand something, and even if you do try to put yourself in someone else's shoes, you still might not completely understand the depth of the situation. So just, be thoughtful, be considerate, be more empathetic and sympathetic, and just always try to be your best. I hope that this gave you guys something to think about. I assume that people who are watching this have older family members or have people that they work with or interact with in some type of setting that are older, that have issues, that are struggling with the aging process. And so I just hope that you are being a kind person in their life. And I'm not saying that you have to outright be like, oh, I know you can't do this that well anymore, so do you want me to blah 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 blah. Like, that doesn't sound very kind. But you can definitely be like, what is a way that I can help or make something a little bit easier for someone and not make them feel like they're unable, because you don't want to make them feel that way either. You want to keep them with some autonomy. So just brainstorming ways that you can be a good person to someone who is experiencing the aging process is my recommendation for you. The number of people who are gonna be considered older adults is just growing and growing. So really just making sure that we are also adapting and also trying to be considerate, be aware of the state of the shifting population age groups. A lot of things, like if you're disabled, for an example, you can't hear or you can't see or you need to use a wheelchair, like it's clear for those communities that there is not as much accessibility, that the world is not built for them, and the world is also not always built for older people. So there's a lot of things that would be so helpful to older people to be changed or to be adjusted, but since that stuff takes time and who knows if that stuff will happen, at least we as individuals can try our best to help with kind of molding the world, shaping the world to be more adaptable and accessible to older people, and to help them retain some sense of autonomy, and to not make them feel like they can't do anything anymore. Because a person can still walk, but if they like taking a route that has crosswalks that are not long enough for them to be able to get across safely and in a timely manner, then it can make them feel less able to go out to do things, to get some sun. If the world isn't accessible to older people, then their world is just going to shrink. So please keep what I said in mind and just try to understand that they are also going through things, that this transition, this process is not easy for them, that they may potentially have trouble, even if they're already like 90 years old or something. That doesn't mean that something becomes easier all the time. So I feel like I said keep that in mind like 90 times already, but keep it in mind, and I hope that you were able to really let my message sink in, and I hope that the aging adults around you feel a difference. They feel better when you try to just be more conscientious and more helpful to them. Have an amazing day, an amazing week, an amazing month, an amazing year, and an amazing life. And I will see you guys next time.